Today on Healthy Living, I'm joined by Dr. Jacqui to talk about collagen and how to pick the right kind to target the specific needs that you're looking for. Good morning.
Good morning, Peyton.
Just to start us off, can you tell me a little bit about collagen, what it is, how it works?
So collagen is a building block for a lot of our tissues, and you can find various forms of collagen on the market. And basically all collagen is similar in the sense that it's all hydrolyzed, so it's broken down into small little peptides so that our body can utilize it and absorb it. And it's really helpful for things like hair, skin and nails, bone health, connective tissue, ligaments and joints, that sort of thing.
So I think when we go to the store, there's lots of different options, lots of brands. How are we able to pick what is right for us, and what are some things to maybe look out for?
Well, that's a great question, and I feel like there's a lot of confusion on the market. So if you go into a health food store or a pharmacy, you'll see a lot of different options and a lot of different claims. So I think the best way to look at how to choose a good collagen is to decide what is it that I want to have that collagen accomplish for me. So for example, if we're looking to support bone density or bone health, or if we're looking to improve the health of our ligaments and tendons, or if we want to focus on skin health, there are more targeted approaches that we can look for. So in many ways, all collagen is created the same. It's all hydrolyzed peptides. But really, if we're looking to enhance the effectiveness of that, then we'd want to look at more targeted approaches. And that's where we look at patented formulas that have more research behind the actual molecule. So for example, a good analogy is if I was to build a house, I would need lumber. So hydrolyzed collagen is like having the lumber arrive at the construction site, and then the individualized peptides are like having the blueprint that goes with those peptides. So it helps direct that collagen to the tissue, and it supports the signaling of our own body's ability to produce collagen in the skin, or to support bone density, or to help rebuild our joints.
So I'm guessing that when you're using collagen, there's other factors that help make it more effective. What are some things we should be doing along with the collagen to get the maximum benefits?
So really what we want to focus on is we can understand the research, but then we want to apply that to our individual body. So for example, are we digesting, absorbing, and eliminating well? So if we don't have optimal gut health, then we can take the best collagen in the world and we won't get much use out of it. And then understanding what's going on at the level of our cell membrane. So for example, if we are in an inflamed state, the likelihood that we're going to get the best benefit from the collagen is minimal. So understanding what's going on at the level of my cell membrane. So a dry blood spot test to measure your omega-6 to 3 ratio is one really great way to understand, am I in a condition, is my body in a state to really absorb and to really benefit from the signaling effects of what those collagen peptides are there to do.
And you brought some stuff with you today. Can you tell me a little bit about some of the things we have in front of us?
So collagen is going to work best if we have enough protein in our diet. So I brought an example of a whey protein, but of course it's always best to get our protein from our diet. But if you're coming in a little bit short in your day, a nice quality protein powder is helpful. Obviously resistance training, so we need to use our muscles. We need to put stress on our bones so that the collagen can help with the rebuilding of those bones. And then vitamin C. So vitamin C is a cofactor for the absorption, and when we're using collagen to support rebuilding, vitamin C is an important cofactor to that. I brought some matcha powder because sometimes people say, well, how do I take my collagen? Do I put it in my smoothie? So a nice warm beverage, so I like to put it in a matcha latte is one example, just something different. And then of course I have the dry blood spot test, which is something that I just think people aren't aware of the fact that there are ways to understand what's going on at the level of your cell membrane, because we can read about a supplement, but then the question is always, I wonder if this is working in my own body. So this is one really great way to gain that information.
I guess my final question is, if you're looking to start maybe feeling a little overwhelmed, what are some resources to maybe ask some questions and get more information?
That's a great question. Well, certainly the viewers can reach out to me. I've put together a one-page resource that helps kind of summarize everything that we talked about this morning. Obviously, there's lots of information available online, and to your point, I think people are just really overwhelmed. They don't know where to start. So honestly, the best way to start is to have a better understanding of what's going on within your own body, within your own biology, and that's where doing simple blood tests and maybe reaching out to somebody who can help you understand a little bit more of how to choose a product for you individually.
Wonderful. Okay, so learning a little bit more about our bodies and how collagen can affect us and benefit us. Thank you so much for joining me, Dr. Jacqui.
Thanks for having me.